I'm Melissa Wright in Omaha, where acknowledging mental health is becoming more common, especially for minorities. For one woman who experienced mental health challenges years ago, she says although the awareness and resources that are available today are great, there's still a lot of work to be done. Gaynell Calloway started using substances when she was 12 years old, and her addiction progressed to crack cocaine by the time she reached 21.
I didn't really even know of any resources that I could use to stay sober.
Calloway says she became sober for 6 years in her early 20s, but ended up relapsing due to the resources that weren't available at the time.
You know, most of us need help to really be able to maintain recovery. That's, you know, it's virtually impossible to do this alone.
Statistics show that substance abuse and mental health relate to each other, and in some cases, substances are used to self-medicate to cope with mental health challenges.
I would say I was pretty close to being suicidal. Didn't have a plan or anything like that, but just the way I was living.
According to the Department of Health and Human Services, 15% of African Americans are living with anxiety disorder, and 13% of both African Americans and Hispanics are diagnosed with depressive disorder in Nebraska. Tori Cassidy with the Heartland Family Service says these statistics are what makes their work with the community so critical.
The reason that it's so important for us to be able to get out there and be proactive instead of reactive is we know that being proactive saves lives.
Calloway, who's been sober for over 10 years, works at the Heartland Family Service in Omaha, an organization that works with the community when it comes to counseling, support services, education, and advocacy.
If they've used or they're just having a bad day, they can call me. My phone's on all the time.
Calloway tells me staying sober and maintaining her mental health is a daily effort, and the resources that are available today she did not have, which is why the work she does is so important. In Omaha, I'm Melissa Wright.